There are 3 questions that must be answered every time we treat pneumonia. First, where was the patient in the last 48 hours? Were they at home or in any sort of healthcare facility? Where infection occurs gives us the best guess of the likely causative bacteria, specifically whether we need to cover resistant strains that are prevalent in healthcare settings like MRSA and Pseudomonas. This in turn will help to determine the choice of antibiotics and the duration of therapy. Where the infection occurs is how we classify pneumonia as either community-acquired, hospital-acquired, or ventilator-associated. It is important to note that these classifications are not an indication of disease severity. A patient with CAP may require intensive care or they can be treated at home, while a patient with HAP may require general medical care, intensive care, or at-home care. Where they are treated is based on clinical presentation and the risk of mortality, which brings us to our second where. Where will they be treated? Are they stable enough to be treated in the outpatient, or do they need the support of inpatient treatment? Here's how we decide. The CURB-65 score is used to assess the risk of mortality. CURB-65 assigns 1 point for each of the 4 patient assessment points of confusion, urea levels, high respiratory rate, low blood pressure, and an age greater than 65 or older. A CURB-65 score of 2 suggests a high risk of morbidity and/or mortality, and therefore the need for hospital admission. Which brings us to our final where. Where in the hospital will the patient be treated? Is the patient stable enough for the medical floor, or does the patient need the additional support of the intensive care unit? To decide, we use the severe CAP criteria. The severe CAP criteria is a diagnostic tool used to predict the probability of ICU admission. It consists of major and minor criteria. The major criteria are straightforward. If a patient is hypotensive enough to require vasopressors, or they need mechanical ventilation because of respiratory failure, we admit directly to the intensive care. If your patient does not clearly need ICU admission, we assess the minor criteria. If there are 3 or more minor criteria, your patient is high risk for ICU admission. Otherwise, the general medical floor will suffice. After answering these 3 where questions, we can begin appropriate antibiotic treatment. Head over to pharmacology.com for the next steps in navigating pneumonia.